Well, you just saw that spot for 7-Day Dental, and today we have on Dr. Christine Chung and Dr. Chuck Lee to tell us all about their services. Particularly, we're going to talk about laser-assisted new attachment procedure. We'll get into that, but first, welcome to both of you.
Good morning, Ken.
Nice to see
Good
you.
morning,
Good to
everyone.
see you. Hey, many times you've talked about gum disease, and I guess is the real name periodontal disease, am I right? Tell us about that, how it happens, even if somebody's taking pretty good care of their teeth, and what are maybe the initial signs of it? How do people know if they have it, even if maybe they haven't gone to the dentist for a while?
Okay, good morning.
Good morning.
It's a very good question, and it's very common. So gum disease has two kinds of stages. One is called gingivitis, which gingivitis is just the inflammation of the gum, and it is reversible, meaning if you clean up the gum will be healthy again.
Okay.
But there's no bone loss or attachment loss involved.
Okay.
But when you get to a more severe stage, it's called periodontal disease, and at that stage, you start losing bone, losing attachment. It's due to bacterial build-up infection, multiple bacterial. Am I right?
Yeah, actually they divide it to 3 stages, and research shows that 75% of Americans have gum disease.
Okay.
As a matter of fact, according to the CDC, 50% of patients or people that are in their 30s, 40s and up have gum disease. Wow. So as she said, gingivitis is the only reversible stage. And because, you know, with the bleeding and it hasn't affected the bone yet.
Right.
But in periodontitis, there's bone loss. And once there's bone loss, it's very hard to regenerate the bone. And as you know, as you can imagine, when you lose bone, the gum, you lose the gum with it.
Right.
And what's the end result? You're gonna lose teeth.
Right. Let me ask you, in basically all, you know, the statistics, all the people that have this, is it just kind of it seems like something that happens to so many people. What causes it? Even people who may take care of their teeth real well, are there different reasons that some people get it and some people won't?
Well, research shows diet, oral hygiene, smoking, chronic illnesses such as diabetes.
Okay.
And also there is some genetic susceptibility. So I usually find that the patient has the minimal amount of decay. For example, a patient that has never had a cavity in their mouth usually will be the one that has the worst gum disease. Because, first of all, you go to the dentist, say, oh, you're perfectly fine when you're younger. Then you instead of going every 6 months, now you go every 2 years. And then you go in again, oh, perfect, everything's fine. And then you hit that critical stage where you start getting medical issues with chronic diseases. Right. And that's when you catch it, but then you don't feel it. Gum disease is a silent disease.
Yeah.
So it's not something that you say, oh my God, I feel like I have gum disease.
Right.
And certain medications also affect.
Right, I was going to ask about that.
Yeah, that would lead to the cause of gum disease. Yeah, and so the first signs and symptoms would be bleeding, bad breath, and so I would urge you, the patients, if you have any clinical signs, early signs, go to the dentist.
Okay, so let's talk about treatment, and particularly this procedure with the laser.
So the traditional way is we go in. Well, root planing is a must procedure, but for more of an involved, moderate or severe periodontitis, we go in and we cut out the gum. That's more like a traditional treatment. But nowadays, you know, with laser has been implemented in so many medical treatments, just like LASIK to ophthalmology. So for laser in gum disease in dental treatment is like a breakthrough because it's fast, it's non-invasive. We don't use a knife to cut the gum open, but we use laser assisted in the dental, in the gum treatment where all the bacterial or the inflamed tissue is removed by laser.
Okay. Now, is this something that is done only for patients who require this? In other words, they're at a certain stage? Or is this something, I know in the past you've talked about laser treatment in just coming in for teeth cleaning and things like that. Are those two different things?
Yeah, well, there's regular cleaning and then
Okay.
there's deep cleaning.
Okay.
And usually, if the gum is very inflamed, we like to implement laser during the deep cleaning.
Is the same laser or is it different?
A laser, there's many types of lasers.
Okay, that's what because I know you've talked about both
Yes.
before.
So what we do is during laser treatment, usually you don't have to numb or very minimal
Very
numbing.
minimal.
Yeah.
Right? And what the laser does is it targets specific bacteria
Okay.
and
Infected tissues.
infected tissues. Then the hygienist is able to go in and remove all the buildup,
Okay.
easier because they
Yes.
can see it easier.
Yeah.
And
On the root surface.
yeah. And most patients love it because downtime is very minimal, and there's not usually very minimal discomfort, minimal bleeding, and minimal downtime. And that's
Okay.
one of the reasons why patients prefer that.
Yeah.
And then if, usually that should do the job.
Yeah.
If it doesn't do the job, then we would have they would do more. They need to see, to get more treatments.
Okay,
Which could
okay.
be traditional gum surgery, where we lay a flap and we clean out the bacteria.
Right.
Or we could do a more advanced laser treatment.
Do you
Okay.
have some
Stage.
slides to show?
Yeah, we just showed one. We just showed one up because what I was going to ask you about this is how do you determine if the laser treatment for the gum disease is the right way to go, or the traditional method? Of course, this might become the traditional method, but with those different procedures, or do you need to do both? Who's a good candidate for this? Because it sounds like if somebody has gum disease, man, they would want this.
Right. Well, there's evidence on the x-ray.
Okay.
We take x-ray. We also have probing. We take the measurements tools to measure
Okay.
any pockets. A healthy pocket should be 1, 2, 3 millimeters. 5, 6, that is very deep pockets, and there's just no way for the patient at home to brush off. Even the dentist cannot have access. Even we use the finest
Okay.
tools. So for those patients who has deeper pockets, they're candidates for lasers.
Okay.
And I think 9 out of 10 patients would accept to do laser more than the traditional cutting gum
Okay.
treatment.
All right.
Yeah, because of the benefits.
Right, exactly. And we've been showing some of the photos here that you sent along to us, and on some of them you can see the before and after using this
Yeah, you can
using
see
this
a
technique.
patient comes in with heavy tartar buildup,
Yeah.
with pockets,
Yeah.
red gum, and then the after picture it heals up and
It's amazing.
regenerate. You can see that the pockets has been regenerated with
Yeah.
new tissue, and it's shown that laser it has proven that with laser treatment we can regenerate bone. We cannot grow back 100%,
Right.
but we can
You can at
regenerate
least
some
help,
bone.
yeah.
And then from
Wow.
there on, the teeth are tightened up.
What's the recovery time? Obviously, it depends on the patient, how severe they are.
Yes.
But you were mentioning that in general, it's much quicker.
Yes.
In a day or two.
Wow.
Yeah, and
Wow.
they can take just Motrin afterwards for pain management.
Over
So-
the counter stuff.
Yeah,
it's just
that's
over the
nice.
counter.
That- much better. I'm looking at some of these pictures that you sent along to us, and it really is incredible that the differences between before and after, and the fact that you said that it can at least help a little bit with the bone tissue.
Yes,
I think that's
it has
fantastic,
proven that.
yeah.
And not only does laser treat gum issues, but it also can help with other, for example, if you have ulcers,
Okay.
yeah, it removes it right away. For people
Wow.
who has it's called
Frenectomy.
Yeah.
Where we remove the excess tissue that sometimes prevent the teeth from closing up.
Oh, okay.
Yeah, and then, and I have some slides also shows that around the implants, if patients have implants
Oh,
and
yes,
lose
we do have
bone
one here.
and lose bone around it, we can also go in, clean out the areas, and it will regenerate bones around the implants to tighten it up. As you can
I was
see.
going to ask you about that
Yeah.
because even people with implants can still eventually have gum problems, right?
Yes,
that doesn't
yes.
get rid of
It's called
it.
implantitis
Yeah.
instead of periodontitis.
Yeah.
And that's laser is the cure of
Yeah.
everything.
Yeah, so it can help with that as well.
And the good thing is it's affordable. It can be a cover benefit by insurance, and we have financing in office for patients, and for Laguna residents we give discount all across the board.
Right.
So we encourage you to come in and have a thorough examination and diagnosis, so we can give you a better understanding of what you need and what you have as a current condition.
Definitely. Yeah, and you can find out there what your insurance covers. Every insurance is kind of different. Sometimes it takes insurance a little bit longer to catch up with the new technologies,
That's
doesn't it?
exactly right.
Yeah.
Insurance is about 7 to 10 years behind.
Is it really?
Yeah.
Wow.
And I just want to add on the aphthous ulcer, usually the canker sore.
Yeah.
You don't have to touch it. It's you're doing the laser, but you're keeping it about 2 millimeters away. So you keep firing the laser beam until there's no more symptom.
Obviously, people are going to ask, when you're firing that laser beam, am I feeling anything?
You feel a little warm, but it's no pain.
Yeah. Okay.
And you can get away without local anesthesia.
Yeah. That's really good.
Yeah.
Yeah.
This
That's
way,
fantastic.
patients, we usually ask them, do you feel better? And they say yes, and then we stop. And of course, laser, patients and the dentist or the hygienist and the assistants are wearing protective
Right.
eyewear.
Yeah,
So
of course.
prevent any damage to your eyes.
Now, if you are interested in finding out, maybe you haven't been to the dentist for a while, 7 Day Dental is located, well, they have lots of offices, but the one nearest you is right there over in the Willow Tree Center on Moulton, and we all know they're remodeling that right now, which
Yes, I'm so excited.
everyone who has a business over there is so excited about. And they can help you out, whether you just need a checkup, maybe you feel you have gum disease, whatever it may be. Great people. We've known them for quite a long time. 7daydental.com. The local number is on the screen, 949-859-3988. That's the right here, Laguna Woods number. And they will help you out and check out if you are a candidate for this type of procedure, if you need it. Maybe you don't. Maybe you just need a teeth cleaning. And you
Yes.
Right?
And I want to thank you for all the patients who have been so loyal to us for the last 17 years that we're here. And we want to welcome new patients. Come on in, give us a call. Anything that we can help, we're here for you.
And Laguna Woods residents get a discount, right?
Yes.
Yeah.
Yes.
All right. And we also want to mention, although you've talked about this in the past, but I want to mention it again, that you help out with veterans programs and things like that. So I think you do that like once a year.
Once a year, we do.
Yeah.
We have a tennis tournament.
Yes, yeah.
Adopt Our Soldier.
That's right.
Where the benefits.
Down in Newport, right?
Yes.
Yeah, I remember. Very good. Good
Thank
to
you
see
so
you,
much,
doctors.
Gary.
Always a pleasure. You
thank you.
take care. We'll be back in just a moment.